we take for granted a little bit, and hopefully giving you signposts to some resources that you might find useful in the future as well when you're dealing with decisions. So you've had quite a bit already over the last couple of days in terms of animal welfare and where we're at. I'm just kind of going to review some of the key points in terms of that. Some of the challenges or things that perhaps we don't necessarily even perceive as challenges. I think for me this weekend has been really interesting in hearing some of your questions and some of your concerns and some of your anxieties, because I think that we are probably slightly disconnected from the things that you guys are concerned about versus what the reality is in terms of the challenges that you might face in practice. So it's been really useful for me to hear some of those things. And then also outline just some of the opportunities that we have available to us as vets. I think often we are very narrowly focused on a certain career pathway, and just to kind of outline some of the other opportunities that you might have for getting involved with wider animal welfare issues. So I'm not going to go over this in any massive detail because you probably know it already. But Mike outlined this really nicely, I think, yesterday when he talked about the Bramble report and the sort of language that was used in that. We know that animals are sentient, and certainly in the European Union, we recognise them as being sentient. And that's what sentience means, and that they have an emotional dimension, that they're aware of their own surroundings. Despite this being quite, kind of old kind of approach, I find it interesting that within the veterinary profession, we are still really frightened of talking about animals having emotional lives or having emotional experiences. We're really frightened as a profession of being judged for being anthropomorphic, and I think we need to kind of be a bit braver around that, because owners know that their animals have an emotional life, certainly for pet animals, and farmers as well. I mean, the farmers know that their animals are able to experience emotions. They don't see them as automata. They work with them on a daily basis, and I think it's impossible to have any kind of relationship with an animal and not recognise that they have the ability to experience emotions, and that how we treat them affects them emotionally. And so I think we need to be a bit braver about that as a profession. In terms of sort of our duty of care, our ethical responsibility, areas that are challenging, I think we have quite a good body of evidence now, particularly for mammals, for terrestrial mammals, around their capacity to feel. We might not always be able to quantify how that experience feels for them. Emotions are very personal, and they're individual responses. But we certainly have, I think, a good consensus that terrestrial mammals do have this capacity to feel. We are, as I said yesterday, quite biased in terms of how we apply that kind of benefit of the doubt across different taxa. My background is zoological medicine, so I'm quite interested in this, in that we often don't really feel like, or don't perhaps give fish the same kinds of protection. I mentioned yesterday that in the United States, under the Animal Welfare Act, for example, they're not covered by anything in terms of legal protection. But there is some evidence there that they certainly can feel negative affective states, negative emotions, certainly physiological and emotional responses such as pain. And some work has been done even in crustaceans, so in non-vertebrate animals, that indicates that they may also experience similar emotional responses. It's very difficult to measure emotions, and I know what I feel about a particular situation. It's difficult for me even to appreciate what you might feel about the same situation, but I do believe that you all have the capacity for emotional feeling. I'm giving you all the benefit of the doubt, but also that's obviously based on my direct experience, and it's based on evidence, and we're getting an increasing body of evidence in other animals, and I think that confers upon us then an ethical responsibility to provide those animals with good welfare, and that can be actually quite challenging. So even invertebrates, again, I do some work in zoos, invertebrate welfare. If you speak to invertebrate keepers or people responsible for managing invertebrates, they are often quite empathetic towards invertebrates. It's probably not even something you've even considered as invertebrate welfare. It's not something that we don't assume that insects or non-vertebrates have any kind of emotional capacity. But I think in terms of future ethical challenges, it's going to be an issue for us, particularly as things like meat consumption become ethically challenging as well, and we're moving more towards alternative protein sources. Things like invertebrate farming have been suggested as being a potential solution. And understanding more about invertebrate welfare, how they experience the world, then confers upon us an ethical responsibility to treat them properly. So that research needs to be done. We don't have a good evidence basis now, but it also means that as you graduate and grow and go out into your careers, that science will continue to emerge. And so it's really important to be quite self-directed and going out and looking for information. You're probably not aware of this organisation. This is Crustacean Compassion. This is an animal welfare advocacy organisation, charity, that campaigns for better standards of farming and slaughter for crustaceans, for crabs and lobsters and other things that you have probably never even considered might have any kind of welfare issues in terms of how they're managed. But seafood is a massive industry, and millions of animals are eaten, consumed as part of the seafood industry every year. And if those animals do have an emotional capacity, at the moment they have absolutely no protection at all. When you consider how they're farmed and transported and how they are killed, that suddenly becomes a little bit uncomfortable if the science catches up and we do think that those animals can experience pain. There's been some solutions proposed. So this is crustastun, which is a crustacean stunning. So we obviously would advocate stunning before slaughter of vertebrate animals. And that is possible as well with invertebrates, with crustaceans. When you consider the alternative in terms of boiling to death in a pot of water, there is some evidence that lobsters and crustaceans do feel pain, then we wouldn't do that to another species. So science is emerging, and I think that from an ethical point of view, we talked a lot about ethics this weekend, we probably do have an obligation as a profession and as individuals who are working in the field of animal health and animal welfare to stay up to date as much as possible with that work, to be aware of opportunities for improving animal welfare, and for communicating that across the profession as well. Positive welfare is something that's become very, I don't want to say trendy, which kind of diminishes it, but an area of increasing importance, I think, and increasing research. I know this is a very big slide with very small writing. But these are the 5 welfare domains which were developed by David Fraser, an animal welfare scientist who's now based in New Zealand, from Scotland originally, looking at basically taking the 5 freedoms type approach, but then looking at kind of flipping those around and providing positive experiences in each of those categories. So positive health, an animal being fit and free from disease, rather than freedom from pain, injury, and distress. Positive, enriching environments that provide opportunities for species-specific behaviours, rather than freedom from, or the ability to be able to stand up, lie down, and turn around. So we are, I think, in terms of how we talk about animal welfare, we are increasingly focused on providing positive welfare issues. Of course, minimising negative experiences goes hand in hand with that, but just minimising negative experiences is not enough in terms of animal welfare. And again, there's emerging research that supports that, and greater communication around positive emotions and how we might measure them or how we might provide for them in animal welfare. This is a workshop that Kathy and other colleagues were involved in earlier this year, the Animal Welfare Research Network. The vast majority of work done in promoting and progressing animal welfare is not done by the veterinary community. We like to think that we are the experts in animal welfare. It's really, really rare to meet a vet who really has a good grasp of what animal welfare is and of the current research. If it's not published in the veterinary literature, we're often totally unaware that it even exists, because we never look outside our own field. And there is actually a massive body of work that's been done by animal welfare scientists whose sole focus is on developing and promoting and improving animal welfare. And so I think it's really important that we do work with colleagues and we do have a cross-sectoral approach. Often as vets, we're not very good at doing that. And as James and David Main have said, what use is there in satisfying an animal's vital needs if the life the animal lives is devoid of any enjoyment? So again, that kind of ethical obligation. What's the point in keeping an animal free from pain, free from fear, free from distress? Keeping it sheltered and fed and housed, if it doesn't have any pleasure in life. Life is all about pleasure. I touched on hedonism this morning, but it is really important to well-being. You know, animals want to enjoy their lives in the same way that we want to enjoy our lives. They want pleasure, they want comfort, they want contentment, they want positive social interactions. Those things are important to them. And so we need to account for those when we're considering their welfare. It's not just enough to be avoiding negative situations. We want to be promoting those positive ones. So understanding the evidence for animal welfare can help us to make better ethical decisions about how we use animals in society, how we value them. As I said yesterday, our knowledge, our culture, our education, our experiences will all influence what we think is right or wrong and the ethical decisions that we make. And the value judgments that we make and our own moral reasoning will influence our actions, and our actions will then influence the welfare of the animals that we manage. And as vets, I think that connection is a lot more direct than it is for a lot of other professions. So it's important to be aware of our own biases, and I think we've talked about this a little bit over the course of the last couple of days. Self-reflection, self-auditing, understanding what motivates us and why we make our decisions. Also understanding other people's points of view and what might motivate them and how they might make their decisions. We've talked quite a lot, actually, about bulldog cesareans, so I thought I'd put a photograph in there. But as somebody mentioned yesterday, we don't necessarily have that same focus on production animals or reproductive welfare associated with production animals. I know that's a very extreme photo. I'm not suggesting for an instant that it's representative. But you know, we do still have these biases towards our companion animals, away from laboratory animals, away from production animals. And so unless we can recognize those biases, we can't address them. So it is important that we do that. And I think it's important to recognize that change is evolution, not revolution in most cases. Change is slow, can be really frustrating. And quite often when you're in the middle of it, you don't see it happening. It can be really frustrating. You think, oh, this is never changing. But it does happen. And I think kind of benchmarking and reflecting back on how things used to be can be really important in recognizing how far we've come. I used this slide in the World Association of Zoos and Aquaria conference where I was giving a presentation. It wasn't very popular. Does anyone know who Otter Benga was? Has anyone heard of him? Otter Benga was a Congolese pygmy. Well, it's from the Congo Free State. And in 1906, he was captured by white people and taken across to New York. And he was exhibited in the monkey house of the Bronx Zoo as a human exhibit. It also happened in Europe. We also had black people in zoos. It's pretty uncomfortable to reflect back and think about that. At the time that that happened, it was societally acceptable, in some parts at least, to do that. Obviously, I think we can all agree that now, and for a long time, that is not, it hasn't been acceptable, it's not acceptable. But at that time, societal ethics didn't challenge it as much. Over time, obviously, it became challenged. And the power to question is the basis of all human progress. I don't think we are able to change and able to progress unless we ask difficult questions, unless we challenge, unless we tackle thorny issues. So whilst that can be emotionally challenging for us to deal with, I think that the potential for influencing change is great. The potential for making significant improvements is great, even though it might be slow. So I think looking back on where we used to be and where we are now, we can see that society has changed considerably for the better. And so we need to keep pushing those boundaries forwards. So, sort of on that note, I want to touch on a couple of issues that I wouldn't describe them necessarily as forgotten issues, but I think as a profession, perhaps we don't always reflect on things that we do on a regular basis. Some things are things that that we do without necessarily always evaluating them. So neutering is something that I find really interesting from an ethical point of view. Who here has a dog? Let's focus on dogs for now. Two. Whose dogs are neutered? That's all of them. Has anyone got an entire dog? Well, a couple of you have. Okay, interesting. Right. Okay, so why do we neuter dogs? What are the reasons for doing that? Population control, yeah. Absolutely. Why else? Prevent some kinds of cancer, yep. Behavioural, yep. Convenience, very brave of you, but yes, absolutely. I think that's something that we don't acknowledge very often, yep. Living with an entire bitch is massively inconvenient. Yeah, so they're all good reasons for neutering. How often do we evaluate the evidence around those reasons? They're quite big reasons, aren't they? Behaviour, it's quite a big thing. Tumours or cancer, another big thing. You know, they're not specific. How do we evaluate the evidence around that? It's quite difficult, actually. It's quite challenging. As a profession, we're not very good at collating evidence, and often we get into the routine of doing things routinely. This is why they are routine surgeries, is because they are part of our daily routine. I mean, we don't tend to question things that we do regularly. But if we're interested in animal welfare or ethics, then that's kind of part of our job, is to question things. So when we neuter is also, I think, something that's interesting. This kind of the 6-month magic, the magic rule of 6 months. What's that based on? Who's done EMS? All of you, most of you. Who in practice has been in a consult room where the vet has recommended neutering at or around the age of 6 months first season? Yeah, everyone does that. Yeah. So, what's that based on? Yeah, it's just like this golden rule that keeps being perpetuated through veterinary practice.
Well, in terms of spaying females before their first season, there's evidence that the risk of certain types of cancers, I guess, increase.
Is there? Yeah, I mean, that's absolutely what people will say. It's usually mammary cancer. That's the one that we tend to focus on. If you spay early, there is evidence of a significant reduction in mammary cancer. Isn't there? You guys are going to be giving this advice. What other kinds of surgeries do we recommend within a limited time frame? What's the best age for amputation? Or removal of any other body part? If you were going to recommend the removal of an organ, would you do some research around that maybe before you made that recommendation to every client that brings you their new dog? But we don't, do we? We don't question it. We don't even think about it. Don't even consider it. We just tell them that's when the best time is. So yeah, we talked about the positives. There are lots of positives to neutering. Population control, obviously. Behaviour, question mark. Which behaviours? What behaviours are influenced directly by gonadal hormones?
Spraying in cats.
So in cats, yeah, spraying can be. Yep. In dogs, though, we'll focus on dogs because the issues are different across the species. It's the only reason I'm...
Wandering in males, like breaking out of their...
So roaming in males, yep, that absolutely can be influenced, yep, yep.
A lot of people say aggression, but it depends on the cause of the aggression.
Yeah, good. So again, traditionally, we would say that neutering can decrease aggression. Some evidence to show that actually it can increase reactivity and certainly increase fear-related aggression. So that can actually make the situation worse, depending on what is motivating your aggression. So removing the gonads can only influence behaviours which are driven by gonadal hormones. If your aggression is motivated because of anxiety, that is not something that originates from your gonadal hormones. So that's a different hormonal response. So we need to understand what's motivating a behaviour before we can make a recommendation. We don't tend to think about it that deeply. We tend to just make these blanket recommendations because it's a routine thing that we've done routinely. So yeah, these are the kinds of things that from a behaviour point of view, the APBC suggest that neutering can help with. So for bitches, you'll see it's fairly limited and they're fairly well defined as to what neutering can help with in terms of behavioural control. Neoplasia, we sort of touched on already, mammary cancer. People almost inevitably say testicular cancer, actually very rare in dogs. Is there a flip side to neoplasia prevention? As in, does neutering have any adverse effects? Yeah, so neutered males have an increased risk of prostatic carcinomas, so you increase their cancer risk by taking their testicles away.
Just the general risk of surgery in the first place?
Sorry, the general risks of surgery, yep, so just your general, I mean, anesthesias are generally quite safe, but you can't eliminate that risk entirely, so yep, actual just surgical risks and anesthetic risks, yep.
Musculoskeletal problems in large breeds?
Yeah, so potentially musculoskeletal problems in large breeds can be a negative. Right, you've all seen EMS, you've all seen vets discuss neutering with owners, you've all seen you've all heard them recommend neutering at around 6 months of age. How many people have heard vets talk about, if we castrate your dog, that will result in an increased risk of prostatic cancer? Or musculoskeletal problems? Probably a few more of you. Yeah, a couple of you. Has anyone ever heard vets talk about potential increased risks associated with neutering in terms of future health problems in general? A few of you, okay. Yeah, we don't tend to do it. We present neutering as being this benign, elective thing that we just do routinely. We are removing organs from an animal. From a female point of view, it's a major abdominal surgery. Just because you do it routinely doesn't mean the animal's experience of it is any less. And potentially, you are creating other risks for that animal in terms of its future health and welfare. And yet we don't ever discuss them. We don't ever give our owners, have that conversation with them. What do we ask the owners to sign when they are submitting their animal to us for surgery? What do they sign? Consent form. What's really important about consent? Informed consent. Does somebody see the conflict here? How do our owners make an informed decision if we don't talk to them about the potential consequences of the procedure that we're recommending? They can't. They cannot give informed consent. And therefore, we are breaking the RCVS code. We probably never consider it in those terms, but something that perhaps as a profession we ought to be considering. So there are potential negatives to neutering. We've already sort of talked about those in terms of aggression, possible joint problems in larger breeds or breeds that are very active. And in some breeds and for some types of neoplasia, increased risks of neoplasia. So there's some evidence in some breeds that indicates that problems like osteosarcoma, mast cell tumor, squamous cell carcinoma, and lymphoma are all increased, particularly in females. The evidence for males is a bit different, and it does vary between breeds as well. So there are very individual factors, but we can increase the risks of neoplasia in a procedure where we're trying to apparently decrease the risks of neoplasia, because that's what we've been taught. And then there's all the ethics around elective organ removal and whether you believe animals have a right in terms of retaining that and the autonomy. So this is a really interesting paper by Peter Sando, which looks at routine neutering of companion animals. In some countries, it's actually illegal, so you can't routinely neuter in some countries in Europe. There are potential problems associated with that as well, because it's seen that it's a mutilation of the animal in the same way that removing its tail or cropping its ears would be a mutilation. Removing its reproductive organs is also seen in some countries as being a mutilation. I'm not saying that I necessarily agree with that point of view, but it is a valid point of view. But I think it is reasonable that neutering or routine neutering of non-free-ranging companion animals raises significant ethical questions. And I don't think as a profession we address those questions very well or consider them. So back to the evidence, because the evidence helps us to make more informed decisions, and I think that's really important. Neutering reduces the risk of mammary cancers. We don't actually know that. We think it probably does, but the evidence for that is weak. And there haven't been any more recent studies than 2012 that have examined that. So the RCVS Knowledge website is a really good website for trying to find out what the evidence is for clinical decision-making in a particular situation. So it's a useful resource. Another useful resource, Best Bets for Vets. This is from the University of Nottingham, where again you can sort of type in a clinical conundrum, or if you want the evidence for things, then this gives you a synopsis of that evidence, and then you can also link through to all of the research papers. It gives you the abstracts of all of the research papers associated with that. So again, that's a really useful website if you're trying to make decisions around case management. It covers a whole variety of things. So the evidence that neutering is protective against mammary carcinomas in bitches is relatively weak, and this should be taken into account alongside other considerations when recommending whether and when to neuter. And as a profession, we almost never do that. We just neuter at 6 months, it'll stop your bitch from getting mammary cancer. It's very straightforward, it's very black and white. It's not. Nothing we do is black and white, but I think we need to recognise that. BSAVA also have recommendations for neutering. On the left is cat neutering, on the right is dog neutering. You will notice that prevention, if you get this off the BSAVA website, you can notice that prevention of mammary carcinomas is not listed for dogs. It is listed for cats. There is some evidence that neutering is protective against mammary carcinoma development in cats, but it's not listed for dogs because the evidence is weak. There are other benefits to neutering. It's a perfectly valid option. My own dogs are neutered, but often we make that decision in quite a black and white way, and it's not that simple. So BSAVA strongly recommends that neutering of companion animals should be considered for reasons of population control and prevention of unwanted litters. But the decision as to whether to neuter the individual animal for medical or behavioural reasons needs to take into account factors such as species, gender, breed, and age of the animal, as well as current and future health status. Veterinary advice should always be sought regarding the risks and benefits in individual cases. There are a number of options regarding the timing and methods of neutering, and these options should be discussed between the owner and the veterinary surgeon. How many people have seen vets in practice actually doing that? Ben. That's it. Yeah, it happens really rarely, and there's lots of reasons and lots of barriers as to why it happens really rarely. Often, maybe the vet doesn't even get to have a neutering consult with the owner. Maybe that, you've got 10 minutes on a consult and the owner's got 20 million questions about a whole bunch of other things. You might be under pressure from the practice to do this. It's practice policy to say we neuter at 6 months or we neuter at the first season and this is what we recommend. So there are lots of barriers, and I know that we've explored some of those barriers, but I think just from a personal ethical viewpoint, we do need to question what we do and why we do it and what the evidence is for doing it, and whether we are always doing the best for our patients or we're just doing what is routine and normal. And quite often we don't examine that. I think it's interesting. So, I've sort of talked about all of these things. So there are lots of considerations that relate to neutering and how and why we might make the decision around neutering. But the RCVS code does say that we should be focusing on informed consent. So the client has informed consent if they've got the opportunity to consider a range of reasonable treatment options, associated fee estimates, and have the significance and main risks explained to them. So we should be doing that for pretty much everything. Okay. I'm going to skip through this. So another example, tail docking pigs. Again, something that is very routine. Who's been on a pig farm? Who's seen tail docking? Yeah, most of you. Okay. What's the legal position around? You can read it. You can read the legal position around tail docking. It's there on your screen. Okay, so again, another routine thing that we do for production reasons, for economic reasons, for animal welfare reasons. And again, there are pros and cons to tail docking or not tail docking. Legally, tail docking cannot be carried out unless other measures to improve environmental conditions or management systems have been taken. And again, this is one of those things that just becomes a default procedure that is done, rather than something that we analyse, actually, have we done all of the other things that we ought to be doing before we default to tail docking. So farms should have a health and welfare plan. This is from the DEFRA codes, which you can find at that URL. It lists the potential causes for tail biting in pigs. I'm going to focus specifically on environmental enrichment because we often use that in a whole variety of different animals, our pets, animals on farms, animals in zoos, whatever. And I think often it does become exactly what it is on this list. It's a bit of a list and a bit of a tick box. So what the codes are saying are that we should have a health and welfare plan, we should be examining the triggers that might cause tail biting, and that once we've put in place management strategies to minimise all of the risk factors, if that's not working, then we can tail dock. In reality, that's probably not what happens. So these pigs have enrichment. They've got a chain and some plastic thing hanging. Do you think that that would be effective in reducing tail biting in pigs? They've got enrichment. Why not? So it's not enriching if it's the same thing every day, if there's no novelty associated with it? Yeah, that's potentially. Yeah, so access to the resource might be a problem in some farms.
It's kind of like an aggressive act, and therefore they're fighting to get to the one who.
So Kathy will know a lot more about this than me. But motivations for tail biting are, as far as I'm aware, fairly multifactorial. There's a whole range of different things that can influence tail biting. Aggression can be one of them, but it's not as simple as aggression or non-aggression. What's the evidence that chains are effective at reducing tail biting? So if we're serious about preventing tail biting, it's not just as simple as providing some enrichment. Legally, this would be sufficient in terms of providing environmental enrichment as a modification. It doesn't work, it won't work, that won't work, and then you can tail dock. But actually, we haven't provided appropriate enrichment that these animals need that we know will reduce that behaviour. So does anyone know what does reduce tail biting in terms from an enrichment point of view? Shout, I think somebody just said it. Straw. Yes, so slatted flooring seems to contribute towards tail biting. Straw bedding can prevent the development of tail biting or reduce it within a group of pigs. So adding straw to a creep area once or more per day decreased the risk of tail biting tenfold. It's a pretty significant decrease. From a management point of view, again, there might be lots of reasons why a farm can't provide straw in terms of barriers and logistics and lots of other reasons. But that is the evidence basis for alleviating tail biting. So if you have a tail biting problem, it's not as simple as just providing enrichment. It's about providing straw. And so understanding what motivates behaviours, understanding the evidence, again, helps us make more informed choices about what we provide for animals. I think very often we focus on the human agenda, and that is totally normal. We all do it. We focus on doing things that are achievable and that make us feel better. This is across different industries, see it all the time. But actually, to improve welfare, quite often we need to self-reflect, self-audit a little bit, and look at the impact of our actions, the impact of the decisions that we make. Are we actually improving welfare, or are we just making ourselves feel better, or feeling like we're doing something that we should? So how do we make a difference? As I said earlier, change is slow. But as Mike has outlined yesterday, our own personal ethics can influence our profession, and professional ethics can influence society. Vets are seen, we are listened to as a profession in society, and there are opportunities for doing that. So be informed. I think, as I've hopefully pointed out over the course of this presentation, a lot of the information is out there, and it's up to us to go out and find it and look at it and discuss it and have some of these challenging conversations. Self-reflect, self-audit. Really happy to see Siobhan's book is a prize at the conference this week. It's a great book. There should be a couple of copies of it in the library if they've arrived. We ordered it a few weeks ago. We have lots of educational resources that are out there, so things like online courses and MOOCs that are free. You can learn more about animal behaviour and welfare, be more informed. Engagement. Within the vet school, there are opportunities for getting involved with things like All Four Paws, which obviously Andrew is a point of contact for. Other charities and organisations, Fostering Compassion. I know some of you will volunteer for Fostering Compassion or have been involved in volunteering for Fostering Compassion. I'm one of their trustees. Other charities are available. I guess what I'm trying to say more widely is that as vets, we do have a skill set and we can engage in charitable outreach and engagement and supporting other projects in the community, and that's a really nice way of making a difference and feeling like you're influencing society and influencing owners. We can develop resources to support owners. So this resource, the puppy contract, Emma mentioned it yesterday. It's brilliant. It's developed by the RSPCA and the Animal Welfare Foundation. It's something that I think the veterinary profession probably doesn't promote as much as we should. Has anyone heard vets talking about the puppy contract to clients in consult rooms? No. There's also something called the Puppy Plan, which is a great socialisation resource developed by Carolyn Monteith. So these resources are out there. So again, trying to point your clients in the directions of reputable resources is really useful. And then within the profession, we can influence change at a higher level in terms of parliament and politics. Been involved in parliamentary inquiries. If you have a particular species interest, getting involved with that divisional organisation, so BEVA, BVZS, the BCVA, etc., BSAVA, you can then help to influence policy and decision-making. Things like position statements that guide veterinary decisions come out of these organisations. There are a whole variety of committees that you can get involved in with different organisations. So just some final thoughts really that occurred to me as we were going through this conference. I've seen repeatedly over the last couple of days quite a lot of anxiety around being struck off. And it's really easy for me to say that, but you've really got to try to be struck off. Like, it's really not very easy. And you almost certainly won't be struck off for clinical decision making. It's really, I can't even remember the last time I saw a vet being struck off for clinical decision making. It's usually bringing the profession into disrepute, which means signing a certificate that you shouldn't have signed, some kind of forgery, or some horrible child pornography or something, something horrible. It's almost never around clinical decision making. So I know that anxiety probably feels overwhelming, but don't let that become, that concern, influence your decision making unnecessarily. There's anxiety around being seen to be difficult, particularly as a new graduate vet. You don't want to rock the boat, you don't want to upset people, you don't want to be challenging. And I think, again, that anxiety is completely reasonable. But I think often we are overly concerned about it. Quite often just having a chat with colleagues about things, about case management, about euthanasia, about some of these things. Often the things that we think are going to be problems are not problems. Quite often we're on the same page. It's just that we've been too worried about expressing our concerns to realise that we're on the same page or we've got similar perspectives. So those barriers aren't always there in reality. So it is worth being brave and trying to engage people in that conversation. Fundamentally, it's your veterinary licence and it's your responsibility. So even if you are working for a big corporate or under pressure from a senior partner to do something, to sign a certificate, to do something that you don't feel comfortable with, your licence is individual. That is your livelihood. It is your licence to practice. And you, in the UK, if you're practicing in the UK, you are responsible for your own actions. So you can't defend something that is indefensible by saying, but my boss wanted me to do it, or the practice policy is that we don't do this or we do that. So you have to be comfortable in that autonomy. It is scary, I totally get it, but that's the way that our profession is set up. And then there's anxiety around career success. I think that depends how you measure success. You guys are all a lot younger than me, but when I was a kid and was watching TV, everyone that grew up wanted to be James Herriot. That was our kind of inspiration. Unfortunately, you guys have Noel Fitzpatrick, but I know, controversial. But yeah, we see, we are influenced by things that we see on TV and in the media and everything else. But I think try not to get tunnel visioned into what your definition of success in veterinary practice is. I think there are lots of opportunities for diversification. There are lots of opportunities to be successful in different ways. Like I said, I used to be a zoo vet. It's what I used to want to be. I'm really happy that I'm not a zoo vet anymore. I really enjoy the job that I have now, but there's no way that 15 or 20 years ago I would have imagined that I would be doing what I am currently doing. I didn't even realise it was a possibility. So be open to new opportunities. Look for new opportunities if you're not happy. Don't be afraid of changing direction. That's totally fine. Doesn't mean that you failed. Be familiar with the Code for Professional Conduct. It is really useful in helping you make some of these difficult decisions around things that you're concerned about. It is a fairly dry document, but it is worthwhile being familiar with it. So you can make the difference. It might not be easy or quick. It can be frustrating. This is the position response that we sent to the Scottish Government on the subject of welfare around tail shortening of dogs. And despite that was actually 3 pages long, despite all of the evidence that we presented in that, along with evidence from a number of other bodies, the Scottish Government has decided that it will allow tail docking of dogs for hunt point retrievers. So yeah, sometimes you do fail, even when you've put lots of work in. But in general, I think we are moving in the right direction of improving animal welfare. And at least now vets are engaged in this kind of activity, whereas perhaps, 50 years ago we weren't even considering it. And remember that veterinary practice is challenging, it is difficult. I know you've probably heard a lot of that over the last 2 days. Be kind to yourselves, be kind to your colleagues, be kind to your clients. Seek support if you need it. There's no shame in asking for help. We've all had those struggles. We might not talk about them as a profession. I think as Rosie said, it's something that perhaps we need to do more of. So don't be afraid of reaching out and asking for help if you need it. Thank you.